I will be doing a presentation on polycystic kidney disease, otherwise known as PKD. So what is PKD? It is a genetic disorder. It is one of the most inherited diseases in the United States, affecting about 12.4 million people worldwide, so pretty common disease. Some characteristics of polycystic kidney disease are abnormal sacs of fluids called cysts that grow inside of the kidneys, typically both kidneys, and over time they take up space within each kidney. And so the more that these cysts grow, the more space they take up, and then the more that the kidney loses function because it is taking up so much space. The typical kidney is about the size of a human fist. And someone with PKD can have so many cysts within their kidneys that they have kidneys the size of a football, and sometimes even weighing up to 30 pounds, depending on how much the disease has progressed. So as time goes on and more of these cysts occupy space within the kidneys, and the more that the kidney loses function, this causes kidney failure, and PKD causes kidney failure in about 50% of patients by the age of 60 years old. So what are some symptoms of PKD? So pain in the back or flank, hematuria, which is blood in the urine, frequent kidney infections, frequent urinary tract infections, feeling of fullness in the belly, high blood pressure. So these are all just some common symptoms. However, not everybody experiences all these symptoms. However, PKD is a painful condition that significantly affects a person's quality of life as the disease progresses. So the molecular cause of PKD is the PKD1 gene. So this gene encodes for autosomal dominant polycystic kidney disease, or ADPKD. And this gene is located on chromosome 16.13.3. And this gene helps the kidneys grow and work properly. The specific protein that it impacts is the polycystin protein, which aids in the regulation of calcium levels within the cells. And this calcium control keeps things balanced within the cell. So it's very important. It's important in kidney development, specifically the formation of the kidney tubules. And it also affects how the cells talk to each other. So it gives them specific instructions so that way the cells can all talk to each other within the kidney. So the mutation in the PKD1 gene is the primary cause of autosomal polycystic kidney disease. The mutations in this gene account for about 85% of ADPKD cases, so quite a bit. So what does that all mean? So the mutation within this gene impacts protein synthesis and function, signaling within the cell, abnormal cell growth and division, stability, and ability to sense mechanical signals within the cell. Let's break that down even further. That's a lot of technical terminology there. So protein synthesis and function. If there is a production of abnormal or even non-functional polycystic protein, then there's not going to be enough calcium in the cells, or maybe too much calcium, depending on the severity of the disease, which helps keep things balanced within the cell. Like I mentioned earlier, it's also going to impact signaling within the cell. So there are primary cilia, which are these hair-like structures on the surfaces of the cells within the kidneys, and those aid in fluid movement, sensing of fluid movement. It also impacts tubule sizes and structure. So if those are abnormal, then it could be too large or too small, or they could just be unstable structures. Another thing it can impact is the abnormal cell growth and division. So that is where the cyst formation comes from. When there is too much cell division or cell growth, that is when cysts are able to form because they're just constantly dividing, which then takes up too much space in the kidneys. Stability and ability to sense mechanical signals. So the fluid movement of the kidneys is extremely important. So if they're unable to sense the movement or the pressure system that is within the kidneys, then that's going to lead to decreased function and possibly kidney failure over time. So this is a genetic disorder, so you inherit it. So it is an autosomal dominant disease caused by a single mutated copy of the PKD1 gene. So a parent that has ADPKD has a 1 in 2 chance or a 50% chance of passing this disease on to their child. And only about 10% of people diagnosed with ADPKD have no previous family history of the disease. So while not everyone in the family may be affected by PKD, it is up to chance. Even though there is a 50% chance of passing it on, it is possible to have children that do not inherit the disease, but it is considered dominant because it only takes 1 mutated copy of the PKD1 gene in order for it to be passed on instead of 2, like most recessive disorders. There is no carrier state for this disease, meaning that if somebody has the mutation in the PKD1 gene, the disease will manifest at some point in their life, typically in adulthood, but technically it could happen at any point in their life. So this disease does not typically skip generations. So like I was saying, you have a 1 in 50% chance of passing it on to your future generations. Men and women are both equally at chance of inheriting this disease if one of their parents has it. And while the same mutation in a family will be the same type of ADPKD, the signs, the symptoms, and the progression of the actual disease can vary, sometimes even drastically. So an example of that is if you have a parent who has not shown any symptoms, but then they have children, and then those children start presenting the disease very early on, it can then cause the parent to get tested to see if maybe that they passed on that gene to their children. Some people don't have symptoms until much later in life, and environmental factors can also play into this, and lifestyle choices can play into this. So here is a example of an inheritance tree, just showing that about 50%, there's a 50% chance that you can pass on this gene onto your offspring. And so the first generation at the top has 3 children, and 2 out of the 3 have PKD, or ADPKD, I should say. And then from there, they can then pass it on to their future generations. So if you have the disease, if you have the mutated gene, then you will have a 50% chance of passing it on to your children. So then from there, it just continues to go through the family tree. So diagnosing of ADPKD, so there are a couple of different steps. So medical history, family history is extremely important since it is a inherited genetic disorder, and then physical examination as well. So since it is a very painful disease, having some of those symptoms might trigger a physician into running further testing in order to confirm or deny the disease. Imaging testing is going to be extremely important. So ultrasounds, MRIs, CT scans, those are going to be able to show physicians if there are already cysts growing within the kidney, and then also the progression, so how many cysts are in each kidney, how large are they. This is going to tell them how much this disease has already progressed. And then there's also genetic testing that can be done. This is good for ruling out or confirming. So if imaging testing is inconclusive, then they can do a genetic testing to see if you are a carrier for this gene, if you have this gene and you just are not presenting yet. It helps with early detection. So if somebody in your family is diagnosed with PKD, ADPKD, then you can get genetically tested for it to see if you are also have that mutation as well, to see if you will develop it later in life. And then it also helps with family planning. So if you are somebody who has the mutated gene, are you going to pass it on to your future children? So there are multiple genetic testing options out there. There's multi-gene panels. One of the most popular one is the next generation sequencing. There's the whole genome sequencing as well, and the Sanger sequencing. So lots of different options there, just depending on what you're looking for and if you would rather have a whole genome sequence, or if you would rather just know about the specific PKD1 gene. So what are the benefits of getting genetically tested? You can identify the cause of the gene, which gene it impacts specifically, and where in the genome it might be located. You can also predict the progression of the disease to see if it is going to, which type of ADPKD you might experience. It also helps with personalized treatment plans. So instead of doing trial and error to try to figure out what might work, you can have a personalized treatment. Physicians are able to create personalized treatment plans based on the genome. And then you can also use it to educate family members who might be at risk. So since it is an inherited disease, if there's a family history of it, it is useful to then see if other people in your family have also been impacted or are at risk. So things to consider when doing genetic testing is family history. Only 10% of people have the spontaneous manifestation of ADPKD. So if there is a family history, it would be important to get tested, so that way you can get that early detection before signs start to show or progress. It's also helpful if imaging tests are inconclusive. They can't tell how much it's progressed or if it has not progressed far enough. Another thing is cost. These tests can run up to $2,000 to $5,000, depending on the specific test that is ran, and then insurance coverage. So some insurances do cover genetic testing, while others do not. So making sure you have coverage there would be important as well. Thank you.